Sorry, I've been working out of town, so I fell behind a little bit. Have a few questions and comments. The first question is, should I allow my son to pee in the shower? I know that's not really a medical question, but just thinking that the shower the water washes down on you while you're peeing, washes your pee away, cleans your private areas while you're peeing. I don't think it's a bad thing. Okay. Next comment or question. So I had posted the importance of wearing a mask. I got a lot of pushback from people who felt that I was promoting a political agenda by promoting wearing masks and that I was part of a conspiracy. So let's just review briefly that in the medical world, which I'm familiar with and a lot of us are familiar with, we wear masks without even thinking because it's a barrier to prevent us from transmitting anything that we have to a patient. And we also wear masks when we are dealing with an infectious patient because we need a barrier to prevent that infection from getting to us. So it's commonly used. You can even watch it on TV. You see the surgeons, surgical nurses, surgical techs all wear masks. They also wear gloves and gowns to prevent the transmission of an infection or an aerosol or a droplet from spraying onto the patient or the patient area. You see it with children that are on chemotherapy, that have a decreased immune system. They wear a mask because it's a barrier to prevent them from getting something from someone else in the air. You actually see this in non-medical situations. Painters, they wear a mask, they wear a face covering, they wear a respirator to prevent them from inhaling the fumes and chemicals from the paint that they're spraying. You see this in farmers when they're spraying insecticides and pesticides to prevent them. They have a barrier to prevent them from inhaling poisons into their lungs. So the mask is a barrier to prevent things from coming in. It's a barrier to prevent things from going out as well. Okay, one of the statements from a gentleman was, well, if I can smell a fart when I have a mask on, that means masks don't work. Okay, it's kind of a simplified argument. It's a good question. But there's some degree of sizes of things that can get in through our nose and into our lungs. Everything has a different particle size. So a fart molecule, if you will, is 100 to 1,000 times smaller than a COVID-19 or a coronavirus particle. So it's easier for the gas molecule from a fart to pass through a cloth mask than it is COVID-19 particles. So the mask still is a barrier to larger particles, but not necessarily to the actual fart molecule. So if your goal is to try and use a mask that will prevent you from smelling other people's farts, I would suggest that you change your friend group. Or if you are the culprit, I would encourage you using more fiber in your diet. So that's it for today. If you have more questions, please keep them coming. Please wear your masks and stay healthy. Bye-bye.